Hello.
Hi.
Welcome back and welcome to video number 3. It is Shelly and Brenda. Today we're going to talk all about CBD. Cannabidiol is known in the short form as CBD. CBD is one of several hundred chemical compounds found within the cannabis plant.
Of the several hundred different chemical compounds found in the cannabis plant, over 100 of these chemical compounds are called cannabinoids. CBD is the second major cannabinoid.
All CBD products do contain a trace amount of THC in it. With that being said, CBD is non intoxicating and CBD will not get you high. So, if you choose to use CBD, it is usually safe to use during working hours.
There are hundreds of different strains of cannabis. Charlotte's Web, ACDC, and Cannatonic are some of the popular CBD strains. You may need to try several different strains before finding the right one that works best for you.
In addition to the strains are classified into 3 different categories. The first one is called sativa. The sativa plant is known to grow tall with thin leaves. It's said to be uplifting, may increase focus and creativity, therefore used during the daytime hours. The indica plant grows short with bushy leaves, known to be more relaxing and calming, therefore we tend to use it in the evening or at bedtime hours. The hybrid plant is a combination of both indica and sativa. However, there is much debate on the differing effects, if any, with the different classifications.
With that being said, due to man evolving the cannabis plant over the centuries, strains are no longer pure sativa or pure indica. 99% of strains are actually now considered hybrids. Presently, strains are described as indica dominant, sativa dominant, or a hybrid, approximately 50-50.
It's important to remember that CBD is not a cure. It is used for symptom management. CBD is most commonly used to reduce frequency of seizures, reduce symptoms of anxiety and depression, reduce symptoms of schizophrenia, reduce multiple sclerosis spasticity, and reduce inflammation resulting in chronic pain.
Even though people choose to use CBD, Health Canada does not endorse the use of cannabis for medical purposes. This is one of the biggest risks of taking CBD. The scientific community doesn't know all the possible risks, side effects, or drug to drug interactions.
Anecdotal side effects include, but are not limited to, fatigue, dizziness, nausea, diarrhea, dry mouth, low blood pressure, changes in appetite and weight, lower blood sugars, and brain fog. Other side effects may occur as each individual response is based on your age, your sex, health, chronic illness, genetics, and other medications you may be taking.
We ask that you monitor for any health changes and side effects. Monitoring your blood pressure and heart rate is especially important if you're taking blood pressure medications. If you are diabetic, we suggest you monitor your blood sugar levels. Keeping a daily diary may be beneficial.
Drug to drug interactions may occur with CBD. A thorough medication review will be done on initial assessment. When starting any new therapy, it's best to start when you're at home and to have someone you trust with you.
CBD is not covered by OHIP or most insurance companies. The average cost of therapy is $150 to $200 per month. If you cannot afford medical cannabis, this therapy option unfortunately is not for you.
CBD is available in oil form, dropper or a syringe, sprays, capsules, bud, or topical lotions. CBD is dosed based on the reason for use, your individual response, and tolerance, such as side effects.
When starting CBD therapy, you will start at a low dose and will increase the dose slowly. Starting low and slow allows you to adjust to any side effects that may occur.
And since we start low and go slow, it may take days to weeks for you to feel any positive effects. Occasionally, it may even take a couple of months, especially when we may have to change strains to find the one that works best for you.
CBD is not known to be addicting. However, you may become tolerant to it, eventually needing a higher dose. The maximum dose of CBD is 1,500 milligrams per day. Most people benefit from a dose as low as 15 milligrams to 300 milligrams per day, with the average dose being 60 milligrams. There is no standard dose for any particular medical ailment. What works for you may not work for the next person.
So, how do we dose? CBD is dosed based on, again, the reason for use, as well as considering other pharmacokinetics, including onset, peak, and duration of action. CBD oils, sprays, capsules, and dry flower, when taken orally, are very similar in onset of action, anywhere from 30 minutes to 90 minutes. The peak action is anywhere from 2 to 4 hours, and the duration of action is anywhere from 4 to 24 hours.
However, dry flower bud taken by inhalation is different, with onset between 5 minutes to 15 minutes, peaking at 20 to 30 minutes, and lasting anywhere from 2 to 6 hours. Inhalation therapy is only ordered if immediate onset of action is needed, such as anxiety, panic disorders, and in palliative care. We use caution with inhalation therapy as this may place you at risk of developing lung disease. With this being said, if you are already smoking cannabis, vaping is then suggested as a harm reduction approach.
CBD therapy has a wide dosing range. We typically start at a low dose of zero point 0.1 to 0.25 mils twice a day. So if you take a look at this syringe here, the syringes actually come in a 1 mil syringe. And if you think of it, 5 mils is 1 teaspoon. So 5 of these full syringes would equal 1 teaspoon. And we only start at zero point 0.1 to 0.25 mils. So that's how small of a dose we start. And again, it's twice a day dosing, usually at breakfast and supper or bedtime. We then adjust the dose based on your individual response and tolerance. And it's best to be taken with food as it is lipid binding.
One of the biggest questions asked is, does it work? This has a broad range of answers as wide as the dosing range. Patients have said it has changed their lives for the better, to the cost isn't worth the benefit or side effects outweigh the benefits, to patients saying that it hasn't worked for them at all. You won't know how it will affect you until you try.
So this concludes video 3, CBD Cannabidiol. Thank you for being with us. You may now proceed to video 4, titled THC Delta 9 tetrahydrocannabinol. Thanks again.